Hello, students. Good to see you once again. It's nice to meet again to discuss one of the interesting courses in community health nursing. Last semester, we looked at Nurs 335, and we realized that community health nursing undertakes a number of services. Today, in Nurs 336, we are going to look at some of these services. Nurs 336 covers occupational and community health services. But to start with, I want you to know that I'm Dr. Patience Anite. I'm a lecturer and the head of Community Health Nursing Department in the School of Nursing. So let's go back to our slide. We are looking at school health services. School health services is one of the functions or one of the services undertaken by community health nurses. School health services constitute an integral part of community health nursing services. I must say that they are a specialized form of nursing care. School health services are considered beneficial for providing continuity of care between the home and the school. This session introduces students to services organized for school-going children to prevent disease, promote and maintain their health as they learn. I'm sure you would agree with me that learning can sometimes be tasking or demanding, and school children need their health to be able to learn. The rationale or the essence of school health services are outlined, and the components of school health are discussed. Students will be introduced to the members of the school health team. The functions and roles of school nurses will also be highlighted in this session. Now let's look at our session objectives. At the end of the session, students should be able to define school nursing, trace the history of school nursing, list the components of school health services, discuss the members of the school health team. That is interesting. We have a school health team. And then finally, discuss the roles of the school nurse. The topic to be covered in this section, as I have said, is school health services. This is your reading list. You have a lot of reading to do because school health services covers a lot of areas. Now, I'm sure you would agree with me that children of school-going age constitute an important resource for every nation. They are an asset, as some people say, and they are our future leaders. Due to their age and stage of development, they face a myriad of experiences that are very complex and challenging. You and I have gone through that. I'm not sure whether you remember, but we all have. As preschool children, school children, adolescents, they have peculiar needs. Adolescents, including school children, have peculiar needs. Some of these needs are unmet, and I believe you know that in nursing, any need that is unmet is referred to as a problem. So school children have problems that warrant special services by health professionals, specifically community health nurses, who are equipped with adequate knowledge, skills, and competencies to be able to address the needs of school children. There are a few questions, just two, I want to bring your attention to. And the questions are, what are the needs of school-going children? It's a simple question, and I believe you have the answer for that. My second question is, what services are available to address the needs of school children? We are looking closely at school health services now. Over time, school health nursing has evolved to become a specialty in nursing. Today, we see school health nursing as a nursing specialty. Let's define what school health nursing is. School health nursing has been defined as a specialized practice of professional nursing that advances the well-being, academic successes, and lifelong achievement of students. In school nursing, organized health activities are provided for children of school-going age within the school environment. For what purpose? It is for the purposes of prevention of disease, promotion and maintenance of health of the school child. I'm sure you can see the functions of school health nurses coming up. Let's look at the historical perspectives of school health services. I hope you haven't forgotten the history of community health nursing we covered in Nurs 335. Some names will come up under school health nursing that we mentioned in that course. School nursing or school health services can be traced as far back as the early 20th century, where through the leading role of a lady called Lillian Wald, a nurse herself of Henry Street settlements, ensured that absenteeism from school children due to communicable diseases were reduced. What happened was that children were absent from schools in her time in the 20th century, and instead of staying home for whatever reasons why they were absent from school, they would rather be found roaming in the streets. So Lillian Wall decided to place specially trained nurses in these schools so as to keep children from roaming the streets and to be in school. So if a child should get a communicable disease and is asked to stay at home, the child wouldn't roam the streets, but would rather stay in school and be treated. Initially, school health nurses focused their treatment on minor ailments, health education, and home visiting. But with time, their roles expanded, and the benefits derived led to the establishment of school health nursing or school nursing programs throughout New York. So we can see that Lillian Wall started it in her area they called Henry Street settlements. But with time, the whole of New York took up this task. I would like to refer you to the recommended text so you read more about the history of school nursing programs. What is the rationale, or what is the reason behind school health services? I have said school children are an important resource, and we need to recognize that they constitute a sizable proportion of populations. For instance, school children constitute a sizable proportion of the population of Ghana. Children in school need to be healthy in order to learn. You and I know that school children have peculiar needs, as I have said earlier, and problems. And it is important that these needs or problems are identified and treated promptly. And school health nursing provides the platform for this. What are the components of school health services? School health services include school hygiene inspection, physical assessment, treatment of minor ailments, health education or health promotion. By now, you should know that health promotion covers health education. That is, health education is an integral part of health promotion. Other services within school health service include immunization, home visits, referrals, and then nutrition services and counseling. So these are the components of school health services. We mentioned that there is a school health team. So who are the people who constitute the school health team? It includes a physician, a dentist, a nurse, probably a community health nurse, a dietitian, and a teacher. But these days, hardly would you find a physician and dentist as part of the school health team. But I believe in high-income countries, physicians and dentists are part of the school health team. What are the roles of a school nurse? What roles does she play? Her roles include health education or health promotion, treatment of minor ailments, physical assessment, that is screening of the school children for any health problems, and then engaging teachers, parents, students, and the community in promoting health or enhancing healthy behaviors. Counseling is also part of the duties of a school nurse, immunization, referrals, and then a needs assessment. In summary, I would say that school nursing is a special type of nursing service rendered, as the name connotes, to school children. Historically, school nursing started as far back as the 20th century, and one instrumental person is Lillian Wald of New York. By assigning nurses to schools, school children were treated of communicable diseases, and absenteeism was reduced among school children. We looked at the components of school health services, one of which is treatment of minor ailments and environmental sanitation. I hope and believe that by now, at least you have some knowledge about school health, which you can share with your colleagues. Thank you.